Hi, I'm Brent Stafford, and this is RegWatch by RegulatorWatch.com. I'm joined here with Dr. Carl Phillips. How's it going, Carl?
Good. How are you?
Not too bad. So we just finished an hour live stream on issues around vaping and research and so forth, and I wanted to take some time to have a chat with you about COVID, because when we did our pre-interview call, it was the very first thing that you had mentioned. So walk our audience through what happened to you towards the, what was it, the end of February? You were like really early on the curve.
It was in March, but yeah, really early on the curve because, yeah, my not so clever ex-wife decided to take the kids to Disney World in the middle of a pandemic. And even though it wasn't too bad in the United States yet, it was bad in various parts of the world, Italy and some others. And of course, people come to Disney World from all over the world. And so, I became I'm sure not the very first case in New Hampshire, but the first one I know of.
Yeah, well, very much. I mean, that's early.
That
So
is early.
what did it do to your body? Like, what effects did it have? Because we hear so many different stories. We also hear, too, that, 80% are asymptomatic, which for most people, you need to understand what that means. That means no symptoms.
Yeah. Yeah. And, it's hard to make sense of those numbers and what exactly counts as asymptomatic, right? I mean, a little hint of a symptom, is that asymptomatic? Well, my case was definitely not asymptomatic. And, I had the classic symptoms that you've heard so much about, the cough, constant cough, the fatigue, the fever. And I can assure you, you do not want to get this disease. I did not end up in the hospital. I was carefully monitoring my vital signs myself at home with bed rest under the advice of a expert on the disease, and never hit the point where I needed to go to the hospital. So, in some sense, you could say I had a mild case, right? Except, March, right? It's now the middle of July, and I haven't gotten over it yet. I'm a lot better, but, after spending 3 weeks more or less in bed, able to get up long enough to prepare meals, but that's about it. I had a very slow on and off recovery, and the on and off is just miserable. I got better, right? I got out of bed. I had 3 or 4 days, and I'm thinking, okay, it's a disease. You get the flu, you get over it, you're fine. And then it came crashing down on me again 4 or 5 days later, and I was back to. And so, in the ensuing months, there were plenty of days where I had three fully, full energy hours, out of the entire day, and the rest of the time I was back to resting up. It's been quite brutal, and the unevenness, the up and down of it over the course of months has just been very demoralizing.
Well, and you're an epidemiologist. So
Yeah,
explain for some of our viewers that aren't coming from the vaping side might, hit this from a different way.
yeah,
What an epidemiologist, I mean, that's disease is what you study, right? Or at least the population effects of disease,
that's
correct?
right. And my specialty in epidemiology is not this particular kind of epidemiology, the tracing of infections and so forth. But it's adjacent to it. I have plenty of expertise here, and of course, like everyone, I became interested in this disease when it started happening, and more than most people, for obvious reasons, I became very interested in it. So, I've acquired a fair amount of specific expertise about it, and you know, it's complicated. We don't have it figured out yet. We don't know why some people like me have these lasting effects and what exactly the lasting effects are and whether they're permanent and so forth. But I went from I was in fantastic shape when this happened, and that's probably what kept me out of the hospital, right? I mean, my respiration rate, my heart rate, and everything were on the, there's a normal range, and then there's an even better than normal range, and my vitals were in the even better than normal range. And during the course of my acute phase of having the disease, they had drifted into the good end of the normal range in the middle of it, and they were heading to the bad end of the normal range. The numbers that I was told I should go check myself into the hospital if I hit. Unfortunately, I never did. But I went from being in fantastic shape to being in terrible shape now. And, just in the last few weeks, I've been able to walk 3 miles, and it used to be that, I would run 3 miles as a casual cool down after working out at the gym for 2 hours. And I can only dream of that now.
So what did, I think my audio's just gone here a little bit. So was there a moment where you felt that your life was in danger?
I never had an acute moment where I started thinking, oh, where's my phone? I'm going to dial 911 and get my finger on the send button or anything. Never came close to that, fortunately. And I certainly feel for the people who did reach that point or worse because of this. But at a thinking level, yeah, of course. I mean, I spent weeks thinking, is this going to continue to slip to the point that, I can't recover from it? We don't have good treatments for it now, and even less so 4 or 5 months ago. And so, yeah, I was worried about it, and I'm still worried about never fully recovering from it.
So let me ask you, with regard to the level of hysteria around the disease, is it warranted? Was the lockdown warranted?
Well, that's a more complicated question, because the mitigation measures, the lockdown, and so forth, they work if they can be used to squash the curve, get things under control long enough to get testing underway, and so forth. And there's a big interplay there as to whether a particular tactic makes sense, because, it's possible, of course, to do something that makes sense under some circumstances, but you only do half of it, and there's no point in doing half of it. You either do the whole thing, or you haven't really done yourself much good. So there's a lot there, but I can tell you that worrying a lot about this disease and trying to minimize how many people get it and how bad a case they have is clearly worthwhile, because there's the focus on the death rate, of course, and that's because it's easy to measure, and of course it's the worst possible outcome. But for everybody who dies, there are 20 or perhaps 50 more who suffer some pretty serious consequences, long-term, possibly permanent, and that makes it a lot worse than most diseases. That's a horrible ratio there.
True. And, I don't want to minimize, obviously, your experience and stuff like that and the illness. But, there's a couple of hard questions to ask. And because you've got the experience on the vaping side, you understand that research on vaping can be quite skewed and mendacious. So a lot of that stuff gets pushed out by the CDC and Centers for Disease Control. So we're talking about an organization that's in charge of all the data, the hysteria and the hype, or put it the other way, the warnings and the safety and the lockdowns and the social distancing. It all comes from the CDC. And so if we're looking at the CDC and are mistrustful of them because of what they did with the so-called vaping-related lung illness, why should we be trusting them with COVID? Because
yeah, well, it's a real problem, and those of us involved in the vaping issues, tobacco harm reduction, and so forth, or many of us, me in particular, have been screaming about this for years, right? I mean, I was a professor of public health when I was working on this, and I would point out they're good people in public health, and the people who work on infectious diseases have been, defunded to some extent in favor of things like vaping and telling people what they should be eating and so forth, and that's really unfortunate. But there remain good people doing those activities, doing real public health, and their good name has been hijacked by anti-vapors, prohibitionists, temperance activists, you name it. And I've been screaming at people for a couple of decades, including, as I said, when I was a card-carrying professor of public health, and trying to say you can't let these people operate with your good name. So you mentioned the CDC. You can't have a trusted organization that we depend on when things like this happen, which is fortunately rare, but that's what they're supposed to be preparing for. They squander their good name putting out nonsense about smokeless tobacco in 2003 and nonsense about vaping in 2017. And, you mentioned CDC, but World Health Organization, WHO, is, one step further worse or multiple steps further worse. And yeah, that's what happens when, you gotta keep resources in reserve for when you need them. And that refers to money, and that refers to skills and people, and it also refers to credibility. You can't say, well, we don't have any infectious diseases going on much. We haven't for a while, so let's just burn all our credibility on it, on trying to get people to behave the way we want them to behave. It's a disaster.
Well, and they've certainly used COVID to get people to behave the way they want them to behave. They practiced up with vaping, and then they moved straight into global quarantine.
Yeah, well, there's a lot of controversy about that and so forth.
Sure. Well,
You know,
let me ask you from an epidemiological point of view. There seems to be a continental divide, like that mimics the kind of one that's happening in public health on tobacco control. Here, yet again, you've got one side of epidemiology, putting out scare stories, the complete total Imperial College catastrophe numbers that forced the lockdown. I mean, it's for everybody to understand. It is completely, totally a world precedent to quarantine the healthy. We locked up 1 billion people. It's extraordinary. The human species has never reacted to an epidemic that way.
well, it's not entirely true, but
Well, in modern times.
it certainly doesn't happen. Well, the SARS virus, and this is technically SARS-2 is its official designation, although it doesn't actually cause sudden acute respiratory syndrome. But the virus is similar. When SARS hit, the places that were hit by it, Hong Kong and so forth, reacted, much as they have with this virus, fairly effectively. And part of the problem is you have to do that reaction right. If you sort of do a half-assed lockdown for a little while and then get bored of it and open back up, but you don't have new technology, you don't have vaccines, you don't have a miracle treatment or anything, then unfortunately you might as well have not done it in the first place, because you're basically starting back at the same spot you would have been anyway. But, Hong Kong, Korea, Japan, various other places, even, Italy eventually got this epidemic under control through social means. But they have to rise to a high enough level, right? And, you've heard about flattening the curve, and we talked about that, and we were reasonably successful at that, even in the United States. With the exception of the disaster in New York City, although we might still have places where the same thing happens. In fact, we probably will.
Well, the question, I
But
mean, the flattening the curve, that just moves things along. It doesn't actually stop the spread of the
that
virus.
because we were talking all about flattening the curve for a while, and flattening the curve is about having possibly the same area under the curve, the same total number of cases, but a lower peak, so that you don't overwhelm the hospitals and have people dying who might have survived if they had gotten good care. And so that was the early talk about the reason for some of the social control measures. But of course, we've seen places that were able to squash the curve, not just widen it, lower it. And in fact, most of the world where there have been potential major outbreaks have managed to do that and United States and Brazil and a few other places are not looking so good by that measure in comparison to our neighbors, our peers overseas, not our immediate neighbors, but our peers.
So I'm going to ask you, I'm going to basically flashcard you some of the, big issues and just get you to kind of give a one-liner, kind of your position on
Sorry,
it.
you're breaking up. I'm not sure whether it's on my end or your
Can you
end.
hear me okay right now?
Yeah.
Okay,
Yeah.
so yeah, I think there is a bit of an audio issue, but I'm being told that we're okay for the viewer. So let's just
Okay.
hope that is the case. So I'm going to do a couple of the issues. I'm going to just hit you with them flashcard and just get you to give me a line or two about that from your position. But
Yeah.
before I do that, because you are an expert in methodology for research, which generally I would say comes down to, can you formulate, design a study that can account for bias? And we've all got bias and, so forth. And in most good science anyhow, you're going in with an assumption of something and you're hoping to prove or disprove. We don't need to get into the big details on that. But the fact is that you're an expert at this, at study design. And so I ask you first, how much your own personal experience with COVID, can you separate that from what would have been, I know, pre-COVID you, when I'm about, because the issues I'm going to throw at you here. So, but before we do that, I'd like to know, is it possible for you to separate the experience from your answers, or can you steelman yourself here when I hit you with the issues?
Well, I mean, the interesting thing about having already had this disease, really early in the policy response, in the United States, is that I'm actually far less worried about it from a personal, selfish perspective than most people ought to be. Because we don't know exactly how effective immunity is for having had it. We don't know how long it lasts and so forth. But it's a reasonably good bet that I'm not part of this epidemic anymore,
Hmm.
right? I'm not going to catch the disease again, not going to catch the virus again, or at least not a substantial case of it. My body will fight it off. I'm not going to transmit it again. So, in some sense, I'm a bystander now. But I'm a bystander who takes this disease very seriously and doesn't think that and thinks that a lot of people don't take it seriously enough because they think of it in terms of just the case fatality rate and
Sure.
not realizing how disastrous it is to have a non-fatal case, a symptomatic non-fatal case of it.
Okay. So,
Um,
okay.
yeah,
Well, okay. So let me just hit it so we can make sure we get to each one. So
yeah.
lockdowns were a good idea. Yes or no?
A lockdown coupled with the resources.
Now you're looking utopia. I was talking what happened. The lockdown as it happened. Was
Yeah.
it?
Depends on where we're talking about. So in New York City, the lockdown would have been better if it had started a couple weeks sooner, but the lockdown there saved lives, not by quashing the epidemic, eliminating it from the population, tracking and tracing. That's what I was starting to talk about. None of that happened, but at least the curve flattened some. And so the hospitals weren't as overwhelmed for as many weeks as might have happened. And that did save lives. You know, whether it turned a fatal case into someone who's severely sick for the rest of their days is a different issue, and one that I'm personally concerned about. But so that mattered. On the other hand, contrast that with here in New Hampshire, where we haven't, much to my surprise, honestly, we haven't had much of an outbreak yet. There's barely any community transmission. My case was imported. And so the lockdown that we did so far maybe didn't accomplish anything. And then it had the unfortunate aspect that it's like, okay, well, we locked down, we've done that, check the box, we're done with that. It's like, no, we didn't do anything yet. We still have a population where 99% of the population is susceptible to getting this disease, and people are back out in restaurants and bars and reopening schools and everything.
Well, and that was going to be my next question. What about the schools? Should students be going back to school at the end of August?
Yeah, I don't think that's a good idea. I mean, it's
but it doesn't the evidence show, though, that young people, I mean, it's very, very small risk of getting ill or even dying at all.
Children have apparently relatively small risk. I mean, my kids were the ones who gave me this, and one of them had a detectable fever, but no problematic symptoms. The other didn't even have the detectable fever. They presumably have exited the epidemic also, just like I have, and perhaps unscathed, though perhaps not, right? This is a nasty disease. People have weird lingering effects from it. We don't know for sure how efficient kids are at spreading the disease, right? So it's possible that somebody is at very low risk of getting personally sick, but is still an efficient spreader. They're very good at distributing the disease to others. And of course, schools aren't just a bunch of kids who are only ever in contact with a bunch of kids. The kids disperse at the end of the day and go spend the rest of the day with family members who are older and thus more vulnerable. And there are staff at the school, some of whom are young adults, some of whom are older adults, and particularly vulnerable. So the problem is not necessarily kids getting the disease, although that's always a risk, and that's a horrifying thought for obvious reasons. But there is the risk of the kids spreading the infection amongst all of themselves, and then
oh my goodness, wouldn't that mean herd immunity if all those kids got it and then the virus tries to get them and they stops? I mean, at some point here, all the kids getting it is a good thing, isn't it?
No, all the kids getting vaccinated is a good thing. That's the best way to herd immunity.
I know, Carl. It's just, I mean, how can we shut down the world like we've done if it's okay? If what happened was okay this time, then it's okay next time.
Places like Korea, which had an initial outbreak that was, just like the initial outbreak in the United States in terms of numbers, practically the same numbers, the same weeks, got it under control, and they're back safely in restaurants and schools and so forth, still wearing masks, but with outbreak tracing, and that that means that there will be a few cases, but they have the resources. They quash the curve down low enough that they can trace every detectable case, quarantine people who are likely to be exposed and thus likely to be spreading it, and keep it under control. New Zealand seems to have gotten it pretty well eliminated. I mean, it helps not to have land borders.
It helps to be an island. Yeah, exactly. Yes.
I guess effectively, Korea doesn't have any open land borders. Also, Japan, other places, but China too is, as far as we know, and you're never quite sure about statistics out of China, but they look pretty good. Italy got things under control after being, of course, an absolute disaster. And, chances are my case traces back to there, just because that's where most, well, I mean,
well, that's where it was really happening, right?
Yes,
exactly. Yeah.
That's where it was really happening, just before I got
so
it.
Let me ask you, because obviously I'm mindful of your time, and I don't want to drag everybody into too deep of the COVID thing, right? I've been careful about that. So lately, the masks. So how is it? So it's a two-part question with the masks.
Yeah.
One, I'd like to know what you think in terms of their efficacy with regards to the overall issue of, not, preventing you from spreading it, or maybe you not getting it because you're wearing the mask. So, I mean, it's efficacy that way. But the more important question that I have is that the human species has been hunted by respiratory diseases since the dawn of time. I mean, it's estimated TB, tuberculosis, has killed 1 in every 10 people that have ever lived in our entire species time, right? And TB was only eradicated to the extent that it was eradicated, 80 years ago or something like that. So, I mean, we have innately built into us a human, an enemy that has been hunting us since the dawn of time. So how is it that we have trillions of dollars spent probably over the last 150 years on public health, and they had no idea, still don't, whether or not a mask helps work to, protect you and the people around you from respiratory illness? This is a mask, and this is respiratory illness, and science, CDC, none of them can give a straight answer. I don't care if they lied or not. Even if they never lied, today, where's the science that settles this? If they can't settle science on respiratory masks, I just don't understand how they just all got to be fired.
Yeah. Just so you know, we had an audio problem there again, so I'm perhaps not answering all of the exact questions that you put to me, but
okay.
Picking out the key words here that I heard. I mean, first off, I mean, the whole mask issue has been just a ridiculous fiasco, because I mean, there's never been any serious doubt that wearing a mask reduces the spread of disease. Anything, the common cold, if people will wear masks, we'll have a lot less cases of the common cold every year. Maybe that's not worth it, but the fact is that we know it. And there are East Asian cultures where wearing a mask, on the subway, wearing a mask if you're at all sick and so forth, are the norms, and it definitely helps. And you can do very simple science and show that it helps, right? You put a mask on someone who has a virus, and you count how much virus there is out in the room, and you don't have it. I mean, there are a couple of cases in the United States where when they reopened, I think it was like beauty salons, hair cutting, that type of thing, and a couple of people working there were found to have had SARS-CoV-2, and of course that means that they were contagious for a week or two, and none of their clients got it. They wore a mask.
Sure, and let me be clear to make sure that, like, when it comes to the audio here, that you heard it, and it sounds like it's a Skype issue that's just you and I, so what's going out to the viewer is fine. Just to make sure, like, in terms of whether or not masks work or don't work, I don't really have a position on that. That is not an issue for me. Where there's the issue is the fact is that respiratory illness has hunted human beings since the dawn of time. And public health, has spent the better part of the last 150 years eradicating TB to the extent that they've done that. And with SARS, with everything else, how we end up in the spot in 2020 where there's even a modicum of debate about the efficacy of masks is a failure of public health to the most enormous extent. They should all be fired. This science should be settled by now, right? On masks.
That's a terrible failure of public health in lots of ways, right? Of not being ready to jump on this because they wandered off and spent their time
on vaping
and drinking and eating dessert and whatever else they're after at any particular time. I mean, that's a disgrace. And we knew, many of us knew, that they were setting themselves up for exactly this problem. Novel pathogens happen, and we're always worried about it. And we tell stories like, what happens if a strain of Ebola becomes airborne and becomes less immediately fatal, so somebody has a chance to transmit it to a lot of people, but it's still very bad for them. And we have specific worries like that. But then there are these out of nowhere or approximately nowhere new diseases that we get periodically, and our bodies aren't ready for them. I mean, as you say, I'm not sure it's fair to say that they're hunting us. They don't really care. They're just there, right? It's a natural hazard, a force of nature and everything. But novel diseases are terrible, right? I mean, 95+% of the population of the Americas was wiped out by European diseases in the decade or two after first contact, because there was a whole population that hadn't seen these diseases before, smallpox and so forth, whereas they still killed Europeans and Asians, of course, but not very many, because most of the people who would be killed by them were already dead. They didn't manage to have kids. We evolved and everything.
Right. And just to make sure to say that the plague was not endemic to Europe. That came from Asia. So much like the European diseases came to North America and wiped out the native population here. And you're right, not hunted. It's just nature that did that. And the same with the plague. The bubonic plague came from Asia, and it migrated into Europe. And,
well, it would certainly be nice if we kept ourselves more ready to deal with these things. But, in fairness about the response, we call it novel coronavirus, or at least some of the press is still calling it that. I prefer the technical scientific term for it. But
you mean Wuhan coronavirus?
The SARS-CoV-2 is
SARS-CoV-2.
The official name for it. But novel is the key word there, right?
Sure.
I mean, we didn't have a very good immunity to this in place already. And, it's close enough related to other viruses that it wasn't like when smallpox dropped into the Native American population and it was just brand new. But we still weren't ready for it. And in this modern world, we do not want our species to have to deal with a new virus the hard way, like our ancestors would, like an animal would, like a plant would, which is like 95% of everybody dies from it. And those who survive are the ones who can live in a world that has it. That is not what we want to do anymore. And we shouldn't be allowing it to happen. And obviously we're not talking numbers like that in this case, but getting to the point of letting this kill everybody that is susceptible to being killed by it and hurting everybody who's susceptible to being hurt by it until it no longer poses a threat. That's not an okay way to deal with this.
Well, I mean, it's obviously, we're still dealing with it, so it's not over yet. And, maybe we'll have you back on after they do lockdown number 3. Sound good, Carl?
Okay, sure.
No. I'm not trying to be glib, actually, because it's a serious disease. It's just so difficult for me because, after years and years of covering the almost daily junk science and propaganda coming out of public health with regards to vaping, which is just so clear. The epidemic, when Gottlieb came out from the FDA and said there was an epidemic of teen vaping and it poses a clear and present danger, RegWatch from that moment for like ever after that said that's the language that public health uses to quarantine cities, locking people down, taking your civil liberties away. And so here they are using that language over vaping epidemic, and this is the FDA. And then a year later, you have a total rollout on EVALI, which is the vaping-related lung illness. By September 6th, everybody knew that it was cannabis. By October 4th, the FDA went, whoa, we're out of this. We can't maintain this lie anymore. And the CDC maintained it right up to February 25th, the day they lit the world's hair on fire for COVID. I'm not saying it is one or the other, but they were exercising a muscle that went straight into COVID, including all of the legislation, the public health legislation that the governors were using in September to ban vaping, to shut down stores, to take away your liberty. And those same public health legislation is what the governors are using to this day to enforce the lockdowns on COVID. So to not have at least a skeptical response or a visceral anger, which I've got anger, there's no doubt.
Yeah, well, I have to say, I doubt there's too much of a straight line from skepticism about, anti-vaping or whatever, and skepticism about the strenuous public health measures that I would argue are strongly warranted by this epidemic.
Sure.
On the other hand, I think you could make a very strong case that people have died of COVID because of the attacks on vaping. And we can't draw a straight line or anything, but because resources, credibility, preparation, and so forth were squandered on, fights that were not only not productive, but were actually, harmful, counterproductive in and of themselves, that burned resources, particularly including credibility, and that contributed to making this worse. I mean, I can't, speaking as a scientist, I wouldn't pretend that we could ever be able to quantify that. But saying it's more than zero, saying that, when this is all said and done, there are going to be people who died of COVID because of the war on vaping. I think that's actually a safe statement to make.
Okay. Wow. Okay. Well, thanks, everybody. This is Dr. Carl Phillips, and on the vaping side, just search his name and give out your blog. That would be good.
My blog, which I wish I had more time to work on, but I've been sick and trying to run this study that we talked about for the main part of this show. My blog is antithrlies.com, so antithrlies.com. And I promise you, I'll get some new stuff posted to it just as soon as I'm recovered enough from COVID to have some spare time.
Well, that's excellent. And look, I really appreciate your time today. Our first show, make sure you check it out. If you are a vapor, it's Recruits Wanted. It's for a major multi-site, multinational study on vaping, which people can be a part of. So you can find that online. You can go to RegWatch. regulatorwatch.com and find that out. And thank you very much, Dr. Phillips.
It was great to be here. Good talking to you. Thanks.
Thanks a lot. All right. Thanks, guys. And we are out of here.